we call ourselves a strict intermediary. Bach is in the training organization. We serve this dual customer role. We serve the employer, we serve the citizen. And everything we do is centers on those two populations, and they're of equal importance. In our initial work, as we've gotten underway with the workforce intermediaries, most employers are interested in retaining employees. There's plenty of opportunities to hire folks, but from a business perspective, it is expensive to be having employees turning over all the time. And we can demonstrate in specific terms how the intervention of career coaching improves the retention level of segments of the workforce in hospitals. That's what interests hospitals. Career coaches will engage with a caseload, if you want to call it that. 20 to 40 coachees is average. Part-time coach would be 20 up to 40. We expect that coach to engage that individual at least once every 6 weeks, some kind of involvement. So I'm the coachee, we call them coachees, and I'm interested in a surgery tech job. That's a good job, and there's going to be lots of them. And you can be making 18, 19, 20 bucks an hour in a few years, and you can get that training in 13 months. So I, as a coach, would help map out how do you get from where you are to getting into that training to succeeding in that training. And they would have, so that coach would have an individual development plan for that coachee that would help them succeed. And you know, we're accustomed to career coaching for executives. Okay, so how does a junior executive become that next vice president, become the director of this, the director of that? We are experienced with knowing about that, but we haven't thought about it as much in the front. We have evidence of research, either through ETO or research at a home hospital, of the results of retention of a coached group versus an uncoached group. In the one example I'll cite for you, it was a significant group. So we're talking almost a couple of hundred. And in increments of 6 months, how many people were retained as patient care technicians? In the general the population was uncoached. After 6 months, there was about 80% retention. After 12 months, it went down to about 60-some, and continued to go lower, and the number was lower out at 24 months. In looking at it incrementally at every 6 months, retention of the almost 100 individuals that were coached never fell below 90%. From the employer perspective, we have great retention levels.